Hey everyone, it's Rena Jadov here with Dr. Neal Barnard, and today we are talking about how to test and track progress, which is one of the chapters in his book, Reversing Diabetes. All right, Dr. Neal, how do we test and how do we track?
Okay, great. So let's say you've changed your diet and you're hoping to see that you can really improve. What do I want to know when I'm at the doctor's office? The first thing that's going to be on your mind probably is your blood sugar control. That's with a test called A1C or hemoglobin A1C. And the doctor does the test, it's just a simple blood test, and I want it to be below 7 if a person has diabetes. If I can get it down below 6.5, you don't have diabetes anymore. If you can get it down below 5.7, you don't even have pre-diabetes. So those are the numbers to strive for. But if you're above 7, that's diabetes in not very good control. While you're at it, check your cholesterol, because the biggest risk with diabetes is heart problems. So when your doctor does a cholesterol test, the thing to really zero in on is your bad cholesterol. LDL, low density lipoprotein. I want that to be below about 100, okay? Sometimes the numbers are a little more liberal. I would like to see that below 100. Some people would say even below 80. But if it's below 100, you're doing pretty well. Now, when you go into the doctor's office, make sure that you're not just a blood test. Have the doctor look at your body too. Your eyes can be affected by this disease. Once a year, have a good dilated exam. This is not going to the eyeglasses guy.
Right.
This is the person who puts in the drops, expands your pupil, and looks at your retina. And when you go see your regular doctor, every time you go in there, undo the laces on your shoes, kick them off, throw off the socks, and sit there waiting for your doctor to come in. And when the doctor comes in, your doctor is going to look at your feet too. Because people with diabetes, they get foot sores that don't heal very well. You want your doctor to check your feet. And this is my secret way of making sure the doctor doesn't forget.
Oh, what a great tip. That's actually brilliant and so simple. One of the things I've heard more lately is get your blood sugar tested, actually not just a fasting, but just regular, you've eaten and now you're getting your blood sugar tested based on how it's reacting after eating food. What are your thoughts on this?
I think you certainly can do that, and many people do. And when we do a specific test called glucose tolerance testing, we're doing exactly that in a really organized way. So I'll give you a measured amount of glucose, and then I'll measure it every half hour. And so that can be a good idea. That gives you extra information as well. And the hemoglobin A1C that I mentioned is a rough guide to how your body is handling glucose really throughout 1 week after another after another.
Oh, okay. Yeah, there's all these cool new wearables as well. I mean, I'm in Silicon Valley technology, so there's things that are, especially in Europe, that are available where you strap it on and it just sort of helps you track during the day what foods you're reacting to. And that way you can start to see, oh, my body reacts disproportionately to, let's say, broccoli versus white potato. I'm just totally making that up because I wish it would react negatively to broccoli, then I wouldn't have to eat it anymore. But what do you think of these new tools, technologies for testing and tracking purposes? Any cool one that you really like?
Yeah, well, I think they can be handy, and I'll tell you one other thing. They're not just a guide to show you if your blood sugar is, say, going too high, but they can also be useful if your blood sugar is going too low. And this will happen on this diet. A person comes in here, or they're reading the book, they're watching this program now, and they say, I want to try that. They go vegan, and it's Monday. On about Friday, they wake up in the morning and they're feeling shaky and they're sweating and they're feeling nervous and they're feeling so hungry they're ready to eat the sofa. What's that about? What they don't know is they changed their diet. The diet is bringing their blood sugar down, but their medicines stayed as powerful as before. So the combination of a good diet and the medicines means your blood sugar is going too low. And your brain is saying, I'm not getting enough glucose here to work properly. And so you start feeling bad. That is the time to call your doctor and say, I think my blood sugar is too low. And the doctor will say, I'll hang on the phone, stick your finger and check your blood glucose right now. I'm in a hold. So you stick your finger and it's too low. And then this is the one and only time.
Okay.
The doctor says, I want you to have some junk food because I want to get your blood sugar right up. And now let's ratchet you off your drugs. So what happens is when people follow this program, their need for medication diminishes. You work with your doctor. The doctor ratchets you off your medicines as the foods exert their benefit.
Which good home tracker do you like? What do you recommend for tracking, kind of pricking that finger at home?
I don't have a preference for it. There are more and more good products every day, and give it a try. See the one that really works for you.
Fantastic. That sounds great. All right. So next episode, we are going to talk about the perfect diet in an imperfect world. And my God, I need to listen into that one because it is so hard to stay on a good diet in this really awful ad-filled world. All right. We'll see you then.
You bet.